And then basically we're going to show you right now with Jaquan, one of the trainers here at Brick Bodies, how the treatment actually goes. Okay. Okay, so what we're going to do, we're going to set parameters on the unit and for our treatment. And again, we adjust these based on the patient, based on your comfort level, based on what you can tolerate over the course of sessions. Okay, and so basically, Jaquan, why don't you tell us what's going on with your Achilles? Basically how your symptoms have been.
So I had a torn Achilles, a little over a year and a half removed out from it. It has healed up some, but occasionally you get some soreness here and there, depending on the activity. Long periods of sitting, long periods of strenuous activity can do that. Prolonged periods of sitting. Basically, I do believe I still have the scar tissue left in there, and the Shockwave Therapy was something I was interested in to see if it would help with any of that.
So when we do the treatment, basically patients give us feedback on how they feel. We can adjust the intensity, like I said, and so here we go. So again, that sound you're hearing is that piston vibrating back and forth. And in certain areas of the body, there can be sensitive spots, so Jaquan will let me know as we're going through the treatment. We're right around the Achilles tendon right now. Here's the base of the Achilles where it attaches on the calcaneus.
That's the most sensitive area.
Yep.
On the heel.
Yeah, the bony areas that don't have a lot of cushioning are going to be your most sensitive areas. So, unfortunately, it's not a therapy that feels great while you're doing it. This isn't a massage element. Everybody has different levels of what they can tolerate. So again, we can adjust it, and we do. So as we're working around that, those sound waves are being emitted through the tissue. It'll can break up scar tissue. Again, the main mechanism is that it stimulates healing. It stimulates healing almost as if you had an acute injury. It sounds kind of weird to injure something to make it heal, but that's basically the concept. It's not causing any tears in the Achilles, major tears. This is all on a micro level. So, and we'll work up into the calf muscle a little bit. We can go around what's called the soleus and the gastroc, and we're working right on his Achilles, getting good coverage. You can change the positioning in which I'm doing it, the rhythm, the pattern, if you will. And each different areas of the body have different recommendations on how many treatments to go with, how long the treatment goes for, how many shocks that are involved in the area of the body. But we have had great results with patients with Achilles tendinosis, with plantar fasciitis. These nagging lower extremity injuries, we've seen a lot of really, really positive outcomes. If you've tried things, for something like knee pain or low back pain, if you've run the gamut with injections, you've had more cortisone than you can count, and if that gave you relief for a while and you find yourself still going back to get cortisone injections, this is one of many things that is available that's an alternative to that, and that's a good way of looking at it. There are other options for treating chronic symptoms in the body besides a medication to mask it or cortisone injection, which is a steroid and it reduces the inflammation in the area, but people have different responses to cortisone.